Good afternoon and welcome to our media briefing. I hope certainly all of you enjoyed the weekend and had a chance to maybe get out and get some fresh air and at least enjoy the environment. We have a lot of ground to cover today, and so we're going to get right to the questions after we hear the updates from Supervisor Fletcher and from our Public Health Director, Dr. Wooten. Supervisor.
Thank you, Chairman Cox, and good afternoon. As a region, we continue to manage our way through this phase of our coronavirus pandemic. Obviously, we had tremendous initial success, and then we had a little period of time where we saw a significant increase in our cases, and we're now coming together collectively to try and slow the spread, to try and get our case counts down, our outbreaks down, to work our way off of the state monitoring list. And we're navigating through all of this difficulty and challenges together. Before we get into today's numbers, I just wanted to touch, in the early days of our coronavirus pandemic, we spent a lot of time talking about personal protective equipment, and in particular, the numbers of things that we had distributed. As we got good systems in place, that became less of a daily concern for public reporting, but it's still something the county works on every single day. And I want to share with you that today, we crossed the threshold of having distributed more than 10,000 individual items of personal protective equipment. This includes more than 5.3 million masks, 1.3 million gloves, and 1.3 million gowns, and 3.2 million gloves. And this represents a collective effort and team to support our public health sector, our hospital sector, along with a number of other entities. And I want to commend everyone who's been working hard on that. We've also surpassed 10,000 hygiene kits being distributed. In the early days, we talked a lot about the importance of hygiene kits for the unsheltered, and so those efforts certainly are ongoing and continue. Let's jump into today's reports. We'll start first with our T3 chart. Here you'll see our testing remains very strong. You will see right there at 8,997 is our 7-day average of tests. We're still far in excess of that goal of 6,600, which is our daily goal that we want to see. We also have a 5% 7-day average of percentage positive of new cases, which is consistent with the goal that we've outlined there, and 568,000 total tests. 7-day average of case investigations, we talked about this a lot last week, and the efforts we have around onboarding new case investigators to increase this percentage and increase it quickly remains below where we want to be at 10%. Our contact tracers are keeping up with the workload that's being distributed, and then you see the 31,000 total investigations performed. Individuals in public health motel rooms you see, and then total doses of donated convalescent plasma. And again, we encourage everyone to go to sandiegobloodbank.org if you're positive or suspect you may have been positive, to see if you might be a candidate to donate convalescent plasma, but a slight uptick there from last week. So thank you to all of those individuals who responded to our call last week. Moving on to our percentage positive and number of positives today, we're reporting 523 new positive cases. Again, that's out of our lower testing total today, 6,456. Remember, on the T3 chart, we're looking at a 7-day average, but we still report every day the 1-day averages, so that's an 8% percentage of positive. Again, one individual day does not tell us a significant amount. You'll notice yesterday was 4, today is 8. What we're really looking at is the trends over time, and you can see the purple line on the top representing a general stabilization of our previous significant increase. We certainly would like to see this number go down. Next chart on hospitalization census. This is our COVID related hospitalizations. You'll see today we're reporting 144 COVID and ICU, 529 cumulative COVID-related hospitalized. I want to take a minute and explain the asterisk, because over the past few days, you can see the asterisks that are there. The state of California, which is where we normally draw part of this data from, has had some gaps in its reporting system. There's been some hospitals that have not been included. And so what we've done is taken the state data, analyzed which hospitals were missing from that data, pulled that direct from the hospitals and added it back into the totals, which gives us a high degree of confidence these numbers are accurate. But again, that is what represents the asterisk, and that's what represents some of the fluctuations you may have seen if you track these charts over the weekend. We believe the state system will be caught up with all hospitals reporting in the near future, but we will continue to show it with an asterisk just to acknowledge and recognize any inconsistency with what the state may be showing. Next, you'll go to total hospital system capacity. What you see there at the bottom are the total COVID-related patients. Again, with the asterisks, which I just outlined from the previous chart, are non-COVID beds in use to give you the total beds in use of 4,385, and again, still below, but certainly creeping up a little bit near that 80% bed capacity. My last chart for the day is ICU utilization, and again, these have the same qualifiers on the asterisk that you see right there. On the COVID numbers in blue, non-COVID numbers for ICU census in orange to bring us to 461, which is 65% of our ICU capacity is presently being utilized, well below the 80% threshold we've outlined as a trigger. That concludes my section of the report. I will now turn it over to Dr. Wilma Wooten for the Public Health Officer's report.
Thank you, Supervisor Fletcher, and welcome everyone to today's briefing. Global, national, and statewide statistics are based on data from the Johns Hopkins dashboard, and these data were obtained today at noon. Today's local statistics in San Diego County from reports as of 11:59 yesterday, and these data are as follows. We are reporting 27,507 cases, which is 523 more cases than yesterday, and this was an increase in new cases since yesterday's report of 283 cases. The overall total number of cases includes 533 deaths. No new deaths were reported since yesterday. The age range is, again, maintaining from 3 months of age to 102 years of age. The 20 to 49-year-old age group remains at 59%, represented by 16,123 cases. 51% of our total number of cases were female, 49% are male. 2,405 or 9% of cases have been hospitalized, and this includes 618 cases that have been admitted to the ICU. This represents 2% of the total number of cases and 26% of the total number of those hospitalized. Again, there are 533 total deaths, which represent 2% of the total number of cases. 235 or 44% of these are female, 298 or 56% are male. 508 or 95% of those who have unfortunately died had underlying medical conditions. We, as always, send out our sincerest condolences and sympathies to the families and friends of those individuals that have lost their lives to COVID-19. Now, since the beginning of the COVID-19 epidemic in San Diego County, there have been 237 outbreaks in 3 primary categories: skilled nursing facilities, other congregate living facilities, and community settings. To provide context regarding these outbreaks, of the total 237 outbreaks, 125 or 53% are now closed or inactive, meaning that there have been no active cases in the past 14 days or longer. This leaves 112 or 47% of the 237 outbreaks being active. The 112 active outbreaks include 22 or 20% in skilled nursing facilities, and we have 86 skilled nursing facilities in San Diego County. Cases include 675 residents, 378 staff, and includes individuals that have died, and that number is 133 deaths. For the non-skilled nursing facilities, 31 of the 112, or 28% of active outbreaks, are in this setting. Cases include 649 residents and 425 staff, members with 89 deaths. And lastly, in the community setting locations, we have 59 of the 112 active outbreaks in this setting location. And these outbreaks include 981 cases with 9 deaths. And in a minute, when I talk about the triggers, we'll go into more detail regarding the community setting locations. So next, I'd like to update you and transition to our 13 triggers, which determine if additional measures are necessary to prevent the spread of COVID-19. And 3 of the 13 triggers are still in the red. Triggers number 1, number 2, and number 11. For trigger number 1, this is related to the case rate. This is a state metric and has the county on the state's county monitoring list. This trigger reflects the rate of cases per 100,000 population for a 14-day period measured using the date of illness onset with a 3-day lag. And currently, this case rate is 144. This is decreasing, but that's really only a 1-day point. Yesterday was over 150. So we will, as always, continue to monitor this closely. Now, trigger number 2 is related to, and actually you can go to the next slide. This shows all of the case rates over the past several days. And as I have already stated, yesterday was at 144. So again, we are continuing to look at this. We would need to get below 100, and in order to get below 100, we would have to have less than 234 new cases daily for 14 days. So, as obvious, a bit of work to go here. Now, let's move to trigger number 2, and this is related to community outbreaks. This slide shows the outbreaks for the past 7 days, and we have 13 total community outbreaks reported. There are 2 new outbreaks reported today from yesterday, and this includes 1 in a restaurant bar and 1 in a retail business. Next slide. So this slide shows the number of community outbreaks by month since the beginning of March and the beginning of the pandemic. And as you can closely see here, once we began to open up various sectors, we started to see an increase in June, and there was a total of 34 outbreaks there, represented by 207 cases. And then for the month of July, the number of outbreaks have almost doubled, close to doubled, and we still have 1 week to go for this month. So to date, for the month of July, we have 59 community setting outbreaks represented by 346 cases. And this slide is trigger number 11, again related to case investigations. The trigger is met if our case investigations, if 70% or less of investigations are initiated within 24 hours of notification over a 7-day period. And as you can see here, we are still hovering at 10%. On Friday, we added on almost just over 90 new case investigators, and by the end of this week, we will add an additional 60 case investigators. So over the next week to 14 days, we anticipate that this number will begin to increase. So to wind down, we have gotten questions about whether someone who has tested positive needs to test negative before going back to work. So we will address that issue at this point. The CDC currently changes guidance for discontinuing home isolation based on new evidence, and that can be found on the CDC's website. CDC's test-based strategy is now no longer recommended to determine when to discontinue home isolation, except in certain circumstances. Persons with COVID-19 who have mild to moderate symptoms and were directed to care for themselves at home may discontinue isolation under the following conditions. And there are three primary conditions. At least 10 days have passed since symptoms began, and at least 24 hours have passed since fever has stopped without taking any fever-reducing medications, and other symptoms have resolved. Now, a limited number of individuals who have severe or critical illness are severely immunocompromised are recommended to wait 20 days after symptom onset and 1 day after fever resolution and symptoms resolving. People who are severely immunocompromised but have no symptoms can leave isolation after 20 days after their first test being positive. People infected with the virus who never developed symptoms and tested positive can stop isolation and other precautions 10 days after the date of their first diagnostic positive test. And this information has been updated in our health officer's order referring to the CDC guidance. So the bottom line is that employers do not or no longer need to have a negative test or two negative tests 24 hours apart for their employees to return to work, but instead follow the new criteria released by CDC and utilize the symptom-based criteria to discharge employees from home isolation before they return to work. In closing, we can get through this pandemic, but it really continuously takes the involvement and the input from everyone, so everyone has a role to play. And we continuously want to emphasize these best practice strategies: washing your hands and maintaining good sanitation in your home and in the workplace, staying 6 feet apart from individuals that are not in your household, wearing facial covering, and avoiding crowds, as well as staying home if you're sick. Please don't wait for anyone or someone that you know, whether it's a family or a friend, to lose their fight against COVID-19 to take action. Now, please welcome back to the podium Chairman Greg Cox. Thank you.
Thank you, Dr. Wooten. We'll go directly to the questions.
Hasadal with CBS 8. Please state your question.
Hello, thank you. So yesterday there was a large church gathering protest on Cardiff State Beach. More than 1,000 people attended. Not very many of them were wearing masks or social distancing. What is your reaction to this? And do you believe there's going to be any enforcement to deter gatherings like this from happening?
Well, obviously, I don't think any of us like it. We wish people would follow the public health orders that have been laid out by the governor. But let me ask Dr. Wooten if she wanted to respond to that.
Thank you, Chairman Cox. Obviously, we are very saddened by the violations that were witnessed on Sunday. From last week, we've actually been working with 3 other churches and getting them to comply with the health officer's order, and we will contact this church as well, because this is not recommended. It really does contribute to others having the potential to be infected, regardless of it being outside. As in the photos that I saw, it really was a massive group of people gathering together without social distancing and without wearing facial coverings. So we will continue to address this egregious violation, as we have others that have been brought to our attention.
And just so I'm clear, the public health order regarding church services is you can hold them outdoors as long as you wear a mask and social distance. Is that correct?
That is correct.
Okay, thank you.
Mm-hmm.
Okay, we'll go to the next question.
Melissa Adon with NBC7, please state your question.
Good afternoon. So at this point, there hasn't been any reported salon outbreaks. Is that correct? As also some stylists are calling to get back to work indoors inside their salon. So will that be possible or even on the horizon here in San Diego County?
Okay, again, I'm going to ask Dr. Wooten to respond.
Over the past 2 months, we've had 2 salon barber outbreaks, one in a salon and one in a barber shop. And CDPH, California Department of Public Health, has been working with the Barber and Cosmetology Board to change their policy of these entities operating outside. So that is possible, although you can recognize that it might be quite difficult for a hair salon to operate outside, but where possible, where that is possible, we encourage those businesses to do that.
Okay, next question.
Matt Hoffman, KPBS, please state your question.
Hi, thanks for your time. About 3 weeks ago, restrictions went into effect for our county for being on that state monitoring list, and at the time knew it was going to be a minimum of 3 weeks that we'd be on there. Do we have any idea of when we might come off? I know when we first got on, we were about 113 per 100,000, or excuse me, 113 cases per 100,000 residents, and that's only gone up. So what sort of lies ahead for us here in terms of that state monitoring list?
Okay, Dr. Wooten will respond.
Well, thank you for that question and the opportunity to show how our actions have an impact on the actions that we take locally from a public health policy perspective. So the question about the churches or a particular church operating over the weekend, if people continue to show or implement the same behavior in terms of gathering, not wearing facial coverings, and not social distancing, it is quite possible we will not get off the list. And but also on the flip side, if we do everything possible to take actions to prevent numbers from increasing, we would have to have 234 new cases or less on a daily basis for 14 days to get off of the state's list. However, the state has informed jurisdictions, once you're on the list, you're on the list. The only thing that getting off the list helps you to do is to open up, say, right now, K through 12. Or at least 7th through 12, because you can submit, elementary schools can submit a waiver. So that's where we are. It really does entail the everyone playing a role, individuals adhering to the best practices that I outline at the end of my update, as well as businesses helping us to enforce those best practices related to facial coverings and social distancing.
Gotcha. And then enforcement, perfect segue into my follow-up. You guys talked about that county compliance team last week, and you said you had more info on it this week. Do we know who's on that team and how they'll be addressing violations?
Yeah, I'm going to take a stab at that one. We're in the process of putting together a team effort, if you will. In fact, earlier today there was a meeting with the city managers and our chief administrative officer to talk about how we will involve all 18 cities in a compliance effort. We expect to take this, actually have the plan together by the end of the week and take it to the Board of Supervisors for their consideration next Tuesday and hopefully approval. Now, in saying that, I want to say the vast majority of businesses are complying. So our focus is really going to be on those bad characters that aren't doing what they're supposed to be doing and trying to figure out how we can either work with them to bring them into compliance, or if we need to take further steps, then we'll figure out what those steps are and have those plans ready to go. I hope that answers the question.
Thank you, it does.
Okay, next question.
This last question is Paul Sisson with the Union Tribune.
Thanks for taking my question. I saw the charts today indicated that there was a cumulative hospital census yesterday of 529 people with COVID in hospital beds countywide. It seems like it might be close to a record. You guys elaborate a little bit on what's going on. Who are these folks that are recently being hospitalized? Do you have any kind of demographic characterization of them? Is it older folks, younger folks? What can you tell us about who's ending up in hospitals recently?
Okay, I believe Dr. Wooten's going to respond.
Thank you. Thank you for that question, Paul. If you look at the table that shows, the graphic that shows COVID-19 hospital daily census, it is a high for the past month, actually. But it's actually, if you compare the bar, part of the bar that's in the yellow for COVID-19 related, that's in the ICU, and then the blue is the COVID-19 related hospitalizations. Again, this is a high for the past month. In terms of, these are COVID-19 cases, both confirmed as well as suspect. And it states there that at the top of the, at least the graphic that I'm looking at. So in terms of if there's different, we need to do, I think, more examination of today's or yesterday's information to look at what actually is contributing, whether it's a particular hospital, but it is a high compared to previous days. And
I ask because,
go on.
Let me interrupt you. Oh, I just, it seems like the entire point of all of these social distancing efforts is to keep our hospitals from becoming overwhelmed, right? So, I wonder if you're concerned that you've seen a 3-day progression of hospitalization increases.
Well, the thing that we don't want to see is what if this remains sustained, Paul, and this is just one day. And so we need to look at if there is a continued trend in the upward or if it maintains at this high number. But we can't base anything off just one day. But we will continue to monitor and report at our daily briefings. Thank you.
Okay, Dr. Wooten, I have 2 text questions for you. The first one is from Lindsay Winkley with the Union Tribune. She asks, occasionally county officials release an estimated number of people who have recovered from COVID-19. In this context, what does recovered mean and how is that number determined?
Well, it is not an actual where we go in and look at the cases and look at the records. It is a calculated or an estimated number, and recovery means that they have been released or discharged from the hospital.
Okay. This next question is from Ashley Mackin Solomon with the PB Monthly. I have a 2-part question regarding Pacific Beach COVID numbers. Numbers in Pacific Beach appear to be climbing, and some have taken time calling it hotspot. What is the role of bars and restaurants and beach access in this? Is there something to which this increase can be attributed?
Well, the increase in PB and all other parts of the county is attributed to a younger population, particularly between 20 and 30, or even between 30 and 49 years of age, going to bars and not adhering to our social distancing best practices, as well as the use of facial coverings where recommended. So again, it's related to behavior. We can talk about the best practices every day, all day, but until individuals adhere and exhibit the behaviors that support those best practices, we will continue to see our numbers increase. And the numbers for COVID-19 have increased across the entire county. There certainly will be locations where the numbers are higher, and we look at that. And in many cases, we may use that to determine where testing should be, or if there are locations where there's not a show of increased numbers, because we want to make sure that there's no area or region or part of our region that is without testing. So testing is very important to identify cases so that we can remove those positive individuals from the community and identify their case contacts.
I'm sorry, I have one more. This one just came in from Taryn Mento with KPBS. Can you provide more explanation behind the record number of tests reported to the county over the weekend? I was told that it included a batch of prior tests from the state sites. How many prior tests from state sites did that batch include, and how far back were those tests collected?
So yes, that is correct. It does did include increased batches. I'm going to welcome to the podium our agency director, Nick Mascione, who is the county lead for T3 strategy.
Taryn, thank you for the question. We've been saying at prior pressers that the state walk-ins moved their commercial lab to let's get tested. And it took time for them to get that into the system. So what we saw was about 6,500 tests that were reflecting the last 10 days of the month. And that's about right. It's about 600 and plus tests per day. So it was about 4% when we saw that large increase, about 4% of infection rate. So those are, if you want to take the average of that, it would represent about 650 tests that we did in the last 10 days that would be reflecting those state walk-in sites.
Well, that concludes our questions for today. Before we close, I wanted to take an opportunity to highlight the work of the San Diego Blood Bank, which is seeking recovered COVID-19 patients to donate valuable convalescent plasma. This plasma has developed antibodies against the virus and can help current patients recover from COVID-19. Last week, we had 42 people complete the online survey to become a donor, which is up from 33 the prior week, but we could still use more. So I urge you to visit the San Diego Blood Bank at their website, which is sandiegobloodbank.org, to learn more. It's a great way to help in this pandemic, and we could certainly use more donors. That's it for today. We'll see you on Wednesday at 2:30 for our next briefing. And as we always say, please stay safe, San Diego. Thank you.